Hi, I am Dr. Raghav Malik, consultant, cataract, refractive and cornea surgical sciences at Center for Sight. Today in this video, I will be describing and actually comparing two very similar procedures. Something known as a smart surface and something known as a traditional PRK or surface ablation. So let's start with the crux of the situation. What exactly surface ablation is? So surface ablation, like the word itself suggests, is a surface procedure. So let's say this is the cornea or the outermost part of the eye. This actually has 5 or 6 layers now. So the outermost part is the epithelium, which is similar to the skin, right? So let's say I make a cut on the skin, so the skin heals very beautifully. Similarly, the outermost part of the cornea, the epithelium, if we remove the epithelium, it grows back very smoothly. So the advantage is that we can actually treat corneas that are much thinner with these powers. Advanced surgeries like LASIK or silk are reserved for corneas that have a certain amount of thickness to begin. But for corneas that are weaker or corneas that are actually thinner, we can do such procedure. So surface ablation, in the topmost layer, we remove the topmost layer and then we fire a laser to remove the power and then put a contact lens on top of the cornea so that the topmost layer can actually grow back in about 4 to 5 days. This is a very old procedure, but a very safe procedure, right? So these are reserved for patients who have weaker corneas and thinner corneas because they grow back very well, right? So now coming on to traditional PRK versus smart surface. In a traditional PRK, the topmost layer is removed by an instrument which is almost sharp, right? So we have an instrument that manually goes over the cornea, removes the top layer, and once that has been removed, then we fire another laser to remove the power, then put a contact lens on top of it. But since it is a traditional and an old technique, we are using an instrument on the eye. This scratches the top layer. So once the layer grows back, it grows back a little slower and there is some pain, right? So of course, since it's in 2025 and 2026, we have such advanced machines. Why should we have to undergo an old procedure that is actually painful? That is why now we have so much advancement in technology that we have something known as a trans PRK. Trans means going through. That means in trans PRK, we can do the similar procedure without having to remove the top layer with an instrument. So it essentially becomes touchless so that the surgeon does not have to touch the eye at all. One variant of this trans PRK is known as a smart surface procedure. That is done on the Schwind Amaris 1050 RS. It is a German machine, and like German technology, it is top notch. It's a simple procedure, simple, touchless, flapless, bladeless, painless. So what will happen is you will go to the surgeon will take a scan of your eye on a machine, and that scan is fed onto the Schwind Amaris machine. And once you go on the day of surgery, you will just lie down on the machine, and once the machine grabs a capture of your eye, the laser just fires on the cornea. So the top layer, which in traditional PRK was removed by a blade, now is removed only with a laser, and immediately after the top layer is removed, the second layer where the power lies, that is also reshaped, and then you put a contact lens on your eye. The beauty is that once this laser cut tissue grows back, there is no pain, there is no irritation, and you can actually have a vision recovery that is much faster. And since there is no human touch, of course it is much safer and it is a much faster healing procedure. So in traditional PRK, you are going to remove the top layer with a blade, while in smart surface it is with a laser, so it is touchless. Definitely in any condition, an all laser procedure is much better and much faster for healing than a manual procedure.
Follow Planet LASIK and post your queries to get answers from the experts.